Welcome back, folks. John Gomez with you. What I call the bell lap of the Tuesday edition of the John Gomez Show. Thanks so much for joining us every single day. We kick it off at noon to 2, lunch with Gomez on 103.9 LI News Radio. You can follow us on linewsradio.com wherever you go, wherever you are, literally. Also, you can hop on board, share your opinion if you care to. Write the number down, 631-451-1039 to hop on board, 451-1039. And you can write to me, Gomez, Gomez, at linewsradio.com. Joining us on the LI News Newsmaker line is Dr. Elaina George, a Princeton University grad, a degree in biology, et cetera, et cetera, et cetera. If I went medical degree from Mount Sinai School of Medicine in New York, I mean, this is top notch. Doctor, welcome aboard. How are you?
I'm fine. Thank you so much for having me on.
Thanks for joining us. Doctor, on the illegal immigration issue, of course, we're seeing, I mean, we're a compassionate country. There's no doubt about that. We want to make sure that the kids are well taken care of while they're here. There is, we keep on hearing these huge numbers, a wave of illegal immigrants coming across our borders. There's an interesting situation here as far as a concern from a medical standpoint. Can you share with the audience, as far as how you see it as a doctor, what we should be concerned with?
Well, I think the most important thing is communicable diseases. You know, these are people who are under duress. They're traveling 1,700 miles. They're dehydrated. They're malnourished. They're children. And a lot of these Central American countries have medical conditions that are endemic to those countries, but not here in the United States. And some of the diseases I'm most afraid of is things like TB or tuberculosis, which has been well under control in our country for quite a while. But as a healthcare professional, everybody has to be treated, or we have to fill out questionnaires every year to make sure none of us have been exposed, because it's so difficult to treat. There's now multiple drug resistance to this. So if you have people coming into the country which they're not being really examined, they're being warehoused, they're being put on buses, they're being put on planes and taken to various parts of the country, and potentially they could be spreading communicable diseases, which once they're out, they're very difficult to control. You know,
Dr. George, another issue that compounds that is, according to our Constitution, according to the laws here, we have to give these or provide these children with a public education. So that, God forbid, if we enter into the fall and we haven't been able to reunite some of these children, or all of the children, with their parents in their home country, these children are going to be immersed into our public school system, and then we have a huge problem.
Well, if you look at the papers, yesterday I read an article actually from Maryland where notes went out to students in a high school where an illegal immigrant child was there who had TB. Ooh. And was exposed his classmates to it. So they had to let the parents know so the children could be tested. So this is already happening. The question is, to what degree and what level are we going to go to starting this fall? I mean,
Dr. George, if that happened, and, folks, our fellow friends here on Long Island in New York, it's interesting because I speak to some people about this issue here up in New York, friends, colleagues, and so forth, and yes, they're concerned, but they think, oh, well, it's down on the border. It's down in Arizona. No. It's down in Texas and so forth. It's, hey, wait a minute. Maryland's not too far away. And
it's not.
And so this, and as you say, they're bused different places. They're plane different places, perhaps train different places. This is a huge problem. And I don't think the average person considers the health risks that are inherent in what we're facing.
Yeah, I think we need to take this is not about compassion. We all are human beings. We want everybody to be healthy. It's not about that. It's about safety. Not only safety for the people coming, but safety for the Americans. And in my opinion, the government is supposed to be protecting us And to just put folks on a bus and drop them off in a Greyhound station without regard to their health status is just irresponsible. And even in California, there are stories coming out about not only TB, meningitis, swine flu, and things like scabies and lice are small potatoes compared to those two illnesses.
I'll tell you something, Doctor. This problem, our border issue, is it's having such profound impact on the safety of all our citizens here in the country. I mean, this is, and I've heard people consider this kind of an attack on our country. And in fact, if one goes down to the very basics of the duties and obligations of our commander-in-chief, I think their primary duty is to protect our borders, to protect us, the country, from an invasion. And in a certain sense, we are being invaded, unfortunately.
I think it can certainly be looked at it like that. I mean, and it's not about compassion either. I want, we get into this emotional conversation because it's designed to shut people up.
Right.
Somehow, if you're mindful of the problems that can come through, somehow you're racist or you're against somebody, and you're not. You're for your family. You're for your other fellow human beings, that we're not putting people at risk. They don't put this on TV very often, but people are dying crossing the border. Children are dying. Yeah. And they're being told or being coerced to come in here. Well, I wouldn't say coerced. I should say encouraged to come, because there's going to be social services. And who stands to gain from this? It's a political issue, not a humanitarian one. And I think if people looked at it like that, they really would be up in arms, because the government really doesn't care about these people. They care about potential votes this fall.
It seems to be that way, Doctor. In fact, I was reading a recent article. It claims, and this is off of Breitbart News out of Houston, Texas, according to a recent poll, or I guess a questionnaire, they say that most of these people, or children or teenagers who are coming over here, it's not due to a fear of violence in their home country. It has more to do with they are being informed that the opportunity of getting a permit when they get here to stay is why they're coming, is because they've been notified that the odds of them getting a permit is very good, and it's not necessarily the violence that they're experiencing in their home country in Central America.
I've actually heard that too.
Yeah.
One of the first ladies of one of the Central American countries came on and said that it's not violence in her country. Yeah. And I'm hearing stories now that they're asking for their children to be bought back because of a brain drain in their countries. So, I mean, what's the story? Are we really getting the whole story, or what the government wants us to know?
Yeah, that's sadly, I think it's the latter. Doctor, I want to thank you for joining us briefly here and giving us a little medical insight to the problem, and I appreciate your input.
It's my pleasure. Have a great day.
Okay, God bless you, Doctor. Dr. Elaina George, sharing a little information. I mean, this is this is part of this problem here that we probably don't want to think about. We're not necessarily appreciating the risks, but it's there. So we're going to go to a quick break, open up the phone line, 631-451-1039. Don't forget, we have a family fun 4-pack of tickets to give away.